Hi, my name is Shannon and I'm the nurse for the day. So first I'm going to start washing my hands before I see my patient. I'm going to turn on the water and use soap and water to rinse and really scrub my hands for about 30 seconds or the happy birthday song, whichever you prefer. I'm going to focus on friction to make sure I get all the different parts of my hands, especially under the nails and in between my fingers and up on my wrist, making sure not to touch any parts of the sink. So after about 30 seconds has passed, I'm going to rinse off, making sure not to touch any part of the sink. Before I turn off the sink, I'm going to get my paper towel and then turn off the sink using the paper towel. And then I'm going to see my patient. Hi, my name is Shannon. I'll be your nurse today.
Nice to meet you, Shannon.
Nice to meet you. So what brings you here today?
I'm having symptoms like very runny nose and itchy, watery eyes.
Okay, so let's take a look at your past medical history. Have you had any shots, surgeries, operations?
No surgery, nothing serious, and all my shots are up to date.
Okay, great. And are you on any medications, over-the-counter meds, herbal, prescribed?
No, I'm not on any medication, but I am allergic to penicillin.
Okay, great. Alright, so when did these symptoms begin? When was the onset?
They started when my family got a dog.
Okay. And do you know what makes these symptoms worsen at all?
Just when I walk my dog and when I'm sleeping with my dog.
Yeah. And can you describe these symptoms for me?
It's just a lot of pressure, like a lot of sinus pressure, and my nose is very runny.
Yeah.
And I have itchy, watery eyes.
Okay, so you said it radiates from your sinuses and like around the rims of your eyes, would you say, or?
Yeah, I would say around the rims and definitely in the corners of my eyes.
I agree. So on a scale of 1 to 10, like how bad do you think the symptoms are? 10 being the worst.
I mean, I'd say a 6 since they only really happen when I'm in constant contact with my dog.
Okay, so you said this is when you're in constant contact. So are they on and off, or are they constant all the time it's running?
They're definitely on and off, but since, now the dog's in the house, it's it's still there, except for when I leave the house.
Yeah. So what do you think this is?
I'm definitely thinking it has to do with my dog.
Yeah, I think I agree with you, but let's just check out your vitals anyway. So first I'm going to take your temperature. The best place to take the temperature is in the ear because it's closest to the brain, but I'm going to go and put it under your tongue because it's just more convenient for right now.
Okay.
Go. So the average temperature is 96 to 99, and let's do this. It's 98.6, so that's completely normal.
Great.
Good job. And the pulse, I'm going to take your pulse right now. Let's see. I don't need this. So, alright. I'm going to put pressure on your radial artery, and then I'm going to lift up lightly, and I'm going to wait for 30 seconds. Alright. Okay, so about 60 seconds passed. I took 30 seconds to feel your pulse, and then I multiplied that by 2, and your pulse was about 72. And that's normal because the normal range is about 60 to 100. Okay. I also took 30 seconds to watch your respiratory rate. Normal respiratory rate is 10 to 20, and yours was 12, so also very normal. So while I was watching your respiratory rate, I was watching to make sure that both of your sides of your chest were rising equally, symmetrically, and that would show that your lungs are working properly and working in sync with each other. And that was good, they were.
Great.
With the pulse, I felt that it was very strong. Not too strong, I would say it was about a 2. 3 would be erratic and, too excited. And 1 would be too weak, and 0 would be absent. So we're happy here too. It was also, very smooth. It didn't seem erratic at all. It just had a very good rhythm. Your respiratory rate was, perfect. I said it was in good range, and your vein had good elasticity, which we find in the elderly that sometimes the arteries can harden, and that can be a problem. But you're young, so you have good elasticity. It was great. Alright, so I'm going to take your blood pressure now.
Okay.
So the golden standard of blood pressure is 120 over 80. As I put on this cup, I'm making sure it's about 40% of your arm between the elbow and the shoulder, and it's about 2 inches from the crook of your arm. as I do this, I'm going to put my stethoscope on so that I can listen to your pulse as I begin pumping up the blood pressure machine.
And is there any sort of way in which my arm should?
It should definitely be at level with your heart. So, and it should be relaxed, and you should just, you know, feel relaxed right now. So I'm going to listen using the diaphragm of the stethoscope to your brachial artery. And when I can't hear your pulse anymore, I'm going to pump 30 more than that. All right, great. So what I did is that I listened for the first heart sound, and that is your systolic, which is the number on top, and that was about 117. And then when I couldn't hear a heart sound again, that very last heart sound, that was your diastolic, and that was about 75. So, I mean, it's pretty much perfect, you know. I mean, 120/80 is the golden standard, but, you know, it wasn't completely abnormal, so I feel like you're good to go. So I think it's definitely allergies since all of your other vital sounds were normal. So I would suggest taking something like Claritin or Benadryl, so, you know, just something over the counter, you know, as needed whenever you feel like it's just, you know, just too much to handle right now.
Perfect.
Do you have any questions?
That's it.
All right, great, nice to meet you.
Nice meeting you.